Hi, I'm here to talk about the Patient Protection and Affordable Care Act. Give you a little bit of information on it so you understand it a little bit better. It's very confusing. The government they did not really give a good explanation. They didn't do good messaging on it, so most people don't understand it. I'm hoping to make it a little bit easier for you to understand. First of all, the Affordable Care Act, as it's been come to be known, was signed into law in March of 2010 by President Obama. The Affordable Care Act has several names. It is known as the ACA, the Affordable Care Act, also known as the Marketplace or the exchanges, and by the slang term Obamacare. Uh, for the website that you go to actually enroll, it's known as the Marketplace. So interchangeably, it can be called any one of those names, but it's all the same thing. People have been a little confused about that, thinking that Obamacare and the Marketplace or Obamacare and the ACA are two different things. They are not. They are all the same thing. Little bit of history. The Affordable Care Act was never meant for the lowest incomes. It never was. It was always meant for those people who do not qualify for any other services, like Medicaid. For those who enroll, even if you are $1 over the Medicaid income, you cannot get Medicaid. And so those people could go and then apply for the Affordable Care Act, otherwise known as the Marketplace. If you apply and you're not eligible for Medicaid automatically, then they apply you for the Marketplace. Now, the Marketplace was meant for people from the age of newborn all the way to the age of 64, and when you turn 65, your 65th birthday. Okay, that was the age that it was meant for. So senior citizens, people 65 and older, are not on the Marketplace. That's been a common misconception as well. Many seniors thought that the Marketplace was being pushed upon them, or that they were going to have to take the Affordable Care Act, and nothing was further from the truth, because seniors were never meant to be on it. Any senior who was on the Affordable Care Act would transition to Medicare on their 65th birthday. Also, the Affordable Care Act becomes affordable by premium tax credits. Premium tax credits are given to people between Medicaid income, $1 over Medicaid income, and all the way up to 400% of the federal poverty level. Okay, those are the people who qualify for the premium tax credits. And like I said, the premium tax credits are what make it affordable for most people. People on the lower income scale, people on the lower side of the income scale would of course get a higher credit, while the people on the higher part of the scale, close to the 400% of the federal poverty level, would of course get a lower premium tax credit. And something else that has been confusing is that you don't actually get that tax credit. It goes directly or is sent directly to your insurance company to help you pay for your premium. So let's say your premium was $300. I'm just throwing a figure out there. It's all over the place, but it could be $300. If your premium was $300 and your premium tax credit was $150, then the federal government would send that $150 to your insurance company, and then what was left, $150, would be what your premium is. That's how that works. All premiums, deductibles, and cost sharing are determined by income with the Affordable Care. Okay? It's all determined by your income, your age, and your zip code. Also, smoking can cause a person to have a higher premium. People have asked me, well, why did they pick that? Well, the reason they picked smoking is because Studies have been done to show that most smokers in their lifetime, the majority of smokers, not every single one, but the majority, will have some kind of big health event or health um, problem or some reason connected with their health that they're going to have to go into the hospital or have to have some kind of surgery. And so therefore they charge more for someone who smokes. It will affect the premium. What's also different about the Affordable Care Act is that you'll never experience a pre-existing condition if you're on the Affordable Care. That was pretty major. People who had cancer and could not get cancer treatments, people with sick children, all of those people who could not get insurance before, when the Affordable Care Act came along, they were now able to get health care because they can't use that pre-existing condition against you. Another thing that's different about the Affordable Care Act is that it includes 10 essential health benefits. Very important. Every health insurance plan has to have the 10 essential health care benefits. They are as follows: ambulatory care, which basically means your doctor visits, going to a doctor's office; emergency services; hospitalization; maternity and newborn care; prescription drugs; mental health and substance abuse; rehabilitative services; laboratory services; preventative and wellness care; and pediatric. Now, of course, I've had people say, well, why should I pay for the things that I don't use, like maternity or pediatrics? Well, the way insurance works is the only way that it works well is if the cost is distributed, if there are enough people in the pool. And so we all pay maybe a little bit more to cover all of this for everyone, which makes it a little bit better for everyone. Everyone gets this coverage, and more people are able to afford it. Okay, I myself don't mind paying a little bit more so that we all can have the same amount of coverage. The ACA was supposed to work in concert with Medicaid expansion. So it worked best in the states where the states actually expanded Medicaid. It took Indiana a long time to do this. And for many years here in Indiana, when they didn't expand the Medicaid, that meant that people who had households with no children were not covered. So a young person without a child wasn't covered. A person in their 50s or 60s whose children were grown and gone was not covered. It was not good. We had quite a few people in the state of Indiana who could not get coverage. But Medicaid was expanded through the Healthy Indiana Plan. They didn't actually call it Medicaid expansion, but that's what it was, through HIP, okay? And it enabled many more people to be covered. And like I said, this was supposed to work hand in hand with the Affordable Care, because everyone was supposed to have some kind of care. Everyone was supposed to qualify for something. So let's say the lowest incomes qualified for Medicaid, different types of Medicaid. The people who couldn't qualify for that could then have Affordable Care, the ACA. And then when you turn 65, you would have Medicare. So all of our citizens would be covered. That was actually how it was planned. That's actually how it was supposed to go. Also, the ACA actually brought money into Medicare. And how they did that, it was a certain amount of money was appropriated to Medicare for prescription drug coverage to help to close the donut hole for seniors. So there was a little bit of money appropriated for Medicare, just to help the seniors with the donut hole. And most seniors have no clue that that was in the bill, but it was. Okay. I also want to address something that's pretty important and hasn't been addressed by a lot of people, but I feel you need to know. It's pretty important. The president got a lot of flack for saying, if you like your health care, you can keep it. Of course, that didn't happen for quite a few people. And there's a reason for that, which I'll explain to you. Now, I feel that the federal government did a really bad job of messaging. They did a really bad job of letting people know that this was coming before it happened. If people would have known why they were losing this health care, they might have thought differently about it. But in fact, the ACA stopped insurance companies from offering fake insurance. Okay, and by fake insurance, what I mean is lots of people had what they thought was health insurance. And then they would go and they'd have a health emergency and they would find out that it covered almost nothing, right? Covered almost nothing. And so those kind of plans were made nil. Those kind of plans were, the insurance companies were not able to sell those anymore. Okay? So people who had those kind of plans did lose their insurance. They did. But like I said, those people didn't have real insurance. If they actually looked on their health card, on their supposed insurance card, usually it would just say health plan, and it would not actually say health insurance. And so, like I said, the ACA, with that law came those fake insurance plans not allowed to being able to be sold to people. And so when this came along and people lost those plans, people who had no idea that they didn't have real insurance all thought that they lost their health care, when in fact they lost plans that they were paying money for, not getting any benefits, which were made illegal. So like I said, the federal government did not do a good job of explaining that to people, that if they lost those plans, they could go to the Affordable Care Act and get a better plan that would actually cover them for something, and they wouldn't be paying for nothing. Okay. Another thing that I didn't mention about the Affordable Care is that it also offered preventative services, and that's huge. Preventative services with no extra cost, no copays, and like I said, no extra cost to the member. Preventative services such as vaccines, things like health screenings, and also things like colonoscopies, which were really expensive. And for women, it would be mammograms, and it would be a yearly cancer test. For those, people could just call their doctor, schedule them, and go. Never pay a copay. It was a pretty great thing because many insurance plans before that had not included those things. And now with the Affordable Care, those were included for everyone. Okay. Messaging is really important, as I said, and I feel that the federal government didn't do a great job of talking about the Affordable Care, explaining it to people, explaining what was included in it, and explaining why people lost fake insurance plans. So I am hoping that what I've done here today helps you to explain the Affordable Care or helps you to understand it a little bit better. Thanks.